Welcome to another episode of Med Madness, where we dive into the critical aspects of medical practice and education. Today we're focusing on the ultrasonographic assessment of gestational age, a fundamental tool in prenatal care. Accurate dating of a pregnancy is crucial for monitoring fetal development, planning tests, and determining the timing of interventions and delivery. Let's start with the basics. Ultrasound is the gold standard for assessing gestational age. Different parameters are used at various stages of pregnancy to estimate this age with varying degrees of accuracy. In the early weeks, specifically between 4.5 and 6 weeks, we measure the gestational sac diameter, which provides an accuracy within 5 to 7 days. As the pregnancy progresses to 7 to 14 weeks, the crown rump length becomes the primary measurement, offering an accuracy of plus or minus 3 days in the earlier part and about 5 days as we approach the end of the first trimester. Next, as we move into the second trimester, from 14 to 30 weeks, we rely on measurements like biparietal diameter, head circumference, and femur length. These parameters maintain an accuracy within 7 days up to 20 weeks, expanding to 14 days between 21 and 30 weeks. Once we hit the third trimester, accuracy can range from 21 to 28 days due to increased biological and environmental variability, such as gestational diabetes or uteroplacental insufficiency. Understanding the importance of early and accurate pregnancy dating cannot be overstated. The first trimester ultrasound, particularly the fetal crown rump length measurement, is critical. It is the most accurate method, estimating the gestational age within 3 days. This accuracy is vital, especially for patients with irregular menstrual cycles. In such cases, the first trimester ultrasound can help re-establish the estimated due date, ensuring the rest of the pregnancy is monitored accurately. It's important to note that while ultrasounds are used throughout pregnancy, their accuracy diminishes as the pregnancy advances. For example, in the third trimester, the variance can be as much as 3 weeks. Therefore, once the estimated gestational age is established early on, it should not be altered based on later ultrasound measurements. Let's consider a practical scenario to illustrate this point. Suppose a patient is initially determined to be at 32 weeks gestation based on a first trimester ultrasound. Later, another ultrasound indicates a measurement consistent with 28 weeks. This 4-week discrepancy is beyond the expected variance for the third trimester, suggesting not an inaccurate estimated gestational age, but rather an issue with fetal growth. Such a discrepancy could point towards fetal growth restriction, necessitating additional investigations like chromosomal studies or torch titers, and further management through serial growth ultrasounds, antenatal testing like biophysical profiles, and umbilical artery Dopplers. After 20 weeks of gestation, fundal height measurements are often used to screen for abnormal fetal growth. However, they are not reliable for gestational age estimation due to potential confounding factors such as fibroids or maternal obesity. When there is a discrepancy of 3 centimeters or more between the fundal height and the gestational age, an ultrasound is essential for further evaluation. To sum up, the first trimester ultrasound using the fetal crown rump length measurement remains the most accurate method for determining estimated gestational age. Later discrepancies should not prompt changes in the established EGA, as they might indicate underlying issues rather than errors in initial dating. Now let's delve into a real-life case study to bring all this information into perspective. Imagine a patient, Maria, who presented for her first prenatal visit at 8 weeks of gestation. Her first trimester ultrasound confirmed her estimated due date with a crown rump length measurement accurate within 3 days. Fast forward to her third trimester, at 32 weeks based on that initial ultrasound, another scan showed fetal measurements consistent with 28 weeks. Given the significant discrepancy, Maria's healthcare provider suspected fetal growth restriction. This prompted further investigations, including chromosomal studies and torch titers, to identify potential underlying causes. The healthcare team also initiated serial growth ultrasounds, biophysical profiles, and umbilical artery Dopplers to closely monitor the fetal well-being and manage the pregnancy effectively. Maria's case underscores the importance of early and accurate gestational age assessment and the need for diligent follow-up when discrepancies arise. It highlights how initial ultrasound measurements guide ongoing care and decision-making throughout pregnancy. That's all for today's episode of Med Madness. We hope you found this discussion on the ultrasonographic assessment of gestational age informative and valuable for your practice. If you have any questions or comments, feel free to share them with us. Until next time, stay curious and keep learning.